Hair loss is a very common complaint that I see in the clinic. Hair loss occurs in 80% of males and 50% of females by the age of 70. So males is much more common, and just in general though, it's a very common complaint. And so everybody's going to have, for the most part, a little bit of hair loss as time goes on. There's different things though that you want to be aware of whenever you are experiencing hair loss that may be contributed to things other than genetics, whether it be family members that you have or thyroid conditions. And some of those things you want to look for is scarring hair loss. So you get hair loss, but hair never returns in that area, and the skin looks a little bit different, maybe whiter appearing or wrinkled. Also, you want to look for inflammation, so redness or sores that develop on your scalp. Places where you have patches of hair loss that are circular. That can be another condition of hair loss that is different than genetic, something that can be treated in the clinic. So those are all things that you want to look for whenever you're trying to decide, do I need to come in for treatment of my hair loss or not? There's lots of different treatment options for hair loss. After you've developed a firm diagnosis for what type of hair loss you have, your provider will decide exactly what best treatment plan is going to work for you. And so some of the things that we typically use to treat alopecia or hair loss is we can use topical medications like minoxidil, better known as Rogaine. We can also use various oral medications like Propecia or spironolactone, depending on whether they're male or female, to help treat their hair loss or at least slow down the progression of hair loss. Now, the gold standard for patients with significant hair loss is going to be hair transplants.